morning. So this is Dr. Anita's presentation, which is Am I a Sex Addict, Hypersexual, or Sex Addict? Clear Your Myths. So for tonight, we will be recording this session for those who can't make it for you to rewatch later. The recordings will be available for up to 30 days from when it was put out. We are pinning the video so that only the presenter will be recorded or their screens. So this means you can choose to keep your video on or off, and if you speak, the recording will pick up your audio and not your name. So you can type your questions in the chat box if you prefer, and depending on the presenter, you could private message them as well. Please keep your audio mute at all times whenever you're not speaking, otherwise, we might pick up your background noise. So we encourage you to check our Sugar and Spice Facebook group for latest updates and announcements. So please do not contact other participants outside of the festival without their consent. You can always ask them for permission through the festival or Facebook group before messaging them. We do not want instances of participants feeling violated or unsafe. And for emotional support, please email us at emotionalsupport@sugarandspice.asia. So I'll be giving the floor to Dr. Anita.
Good morning, everybody. This is Dr. Anita Shyaam. I'm a psychiatrist and a clinical sexologist and a sex coach. And I thank Dr. Martha and all the organizers of Sugar and Spice for this opportunity. Today, I'm going to talk about, are you a sex addict? There are so many myths around hypersexuality and also being called as sex addicts. And today would be the day when I will share some scientific information why these words can be interchanged, misleading, and used as a synonym. Here you go. These are my disclaimers. This presentation is specifically made for the Sugar and Spice Festival. It is a free presentation, and all this information which is going to be presented are from scientific journals, and the references, more detailed references would be available on request. And there's another slide at the end of my presentation, which has very important references. And if you're really interested, those are very good reads and will really help you. My presentation is not strictly restricted to the ICD-11, DSM-5, or the ICM, which are various diagnostic tools available in the field of medicine and psychology. So it involves a lot of information and will help you understand the various aspects of sexual dysfunction. Now, my presentation, I would be using words like challenges. This is basically an interchange word for a sexual dysfunction because I do not like to pathologize sexual behavior, and this is entirely my choice. Thank you. So when we talk about sexual functioning, sexual functioning is it's a very complex phenomena, and it involves the biological processing of the body, the psychological processing, and the social processing. And that's why the biopsychosocial model is very important to understand when we talk about sexual functioning or normal sexual functioning or any form of sexual dysfunctioning. And when all the biopsychosocial process works in harmony, that means your mind and your body works harmony, a person or an individual enjoys sexual functioning, sexual pleasure. And all this process is coordinated by the neurological system of your body, the vascular system, and the endocrinal system. Now, sexual dysfunction is difficulty and a challenge which is experienced by an individual or a couple during the stages of normal sexual functioning, sexual activity. And this involves the cycle, the sexual cycle, which is the desire phase, the arousal phase, the orgasm, and the resolution phase. Now, in any situation when this cycle is interrupted or a person experiences displeasure, then it is called as sexual dysfunctioning. And this causes extreme distress. The word distress is emphasized because it is a very important functioning, important aspect and a feeling when a person is experiencing sexual dysfunction. And the distress is extreme to self and in a relationship. And it also impacts the person's normal functioning. Now, any form of sexual challenges, there can be a single sexual challenge at one point of time, or person can be experiencing multiple sexual dysfunctions. And it is said that 43% in the research, 43% of women and 31% of men can experience or experience one or more kind of sexual dysfunctioning. Now, when we talk about hypersexuality, hypersexuality has been characterized by uh, extreme intense and frequent sexual urges or sexual activity that produces, again, we talked about distress and impairment to that individual. This can be caused by exogenous substances or by a medical condition or a psychiatric condition. Now, there is so much lack of diagnostic criteria to define what a hypersexuality means, that because of all these pitfalls, or we could say the all confusion, they are interchanged with words like problematic online pornographic use, a sexual disorder, a compulsive sexual behavioral disorder, and also it is interchanged with the words sex addict. They're so interchanged that the umbrella consists of various types of, it just simply says there is some problem with this sexual behavior, and that can also be attributed to excessive masturbation, cyber sex, sexual behavior with consenting individuals, of course, and pornographic consumption. So these are all different aspects which can tell you that this person can be hypersexual, or this person can be having just an high sexual appetite or sexual desire. Now, the nature of hypersexuality is demonstrated by the problematic behavior, which is definitely distinct from high sexual desire. That is how one would differentiate if this person is hypersexual, or is he have an hypersexual disorder, or it is just an high sexual disorder. But the main focus should be here is the what problem this person is being facing. So epidemiologically, there is no specific data available of how many people are hypersexual or how many people have hypersexual disorder. But in general, the data suggests that 5% of the general population may meet the criteria for a compulsive sexual disorder. Now, using this criteria that are very similar to the use of substance abuse disorder, because there is a very addictive behavior involved in a hypersexual disorder or in compulsive sexual disorder. And the incidence increases in rates in individuals with schizophrenia, bipolar disorder, and also in individual having pathological gambling. Now, the lack of data and the lack of inconsistent definition of how do you really define hypersexual disorder or high sexual desire is because there is not much research done. There is not much of funding being available to work on this field. And and that is why there is so much of confusion with the diagnostic criteria and whether it should be involved in a disorder form, an addictive disorder form. It is just there's so much of lack of information and research done. It is in the research. It also says that men appear to outnumber women with sexual behavior, with hypersexuality, or with compulsive sexual behavior. And an individual can also show comorbid condition with people high hypersexual disorder are seen with people using substance abuse, they're having substance disorder, or it can co-occur with individual with impulse control disorder. And there is an association with, of course, sexual abuse, childhood sexual trauma, sexual abuse has also been involved with the individual with hypersexual disorder. Now, again, keeping in mind the biopsychosocial model, we talked about how the various psychological aspect and various psychiatric conditions can lead to hypersexual disorder. But there are various pathological conditions, that is the frontal lobe lesion. People with frontal lobe lesion, frontal lobe tumors can show hypersexual behavior. Neurological conditions that involves basically the temporal lobe and the midbrain uh, areas. People with seizure disorders, Huntington disorders, and dementia are shown to have hypersexual or disinhibited behavior, sexual behavior. mainly a lot of focus has been given to the frontal lobe damage, which triggers the expression of disinhibited behavior, which could also partially explain why people with dementia or people with frontal lobe damage show increased sexual activity along with decrease in the control. Now, exposure to pornography has recently attracted a lot of attraction in terms of exposure to the media. And now when there is so much of high definition movies, even nowadays the simple advertisement, there is so much of neurally excitation given to an individual that one has to really think about the exposure of pornography, the exposure of high defined sexuality is also leading to conditions of hypersexuality or even high desire. So exposure to pornography appears to stimulate the reward system. Constant exposure to pornography, high defined sexuality, high def sexuality stimulates the reward system. Now, reward system is an area in your brain which, when stimulated, a person feels excited, a first person feels pleasured to be involved in that behavior again and again. And it is a condition, it is a similar behavior which is seen in individuals who are addicted to substances or addicted to gambling or any type of behavioral addiction. So pornographic consumption also stimulates a pleasant feeling, which I was just talking to you, and the stimulation of the reward system and the stimulation of the reward system causing pleasant feeling. Now, increase in the transcription factor of the DSFOSP also plays a very important role in reinforcement these type of behaviors. Why would somebody really again and again want to be involved in that behavior? Is because there is a reinforcement factor, and it is by the transcription factor. I know this is a lot of medical term, but I just want to let the audience know that this is when an individual comes with a complaint of hypersexual behavior or uncontrolled sexual behavior, there is a lot of biological factor which is also involved than somebody who's just preferring to be involved in that behavior. And also the neural and the behavioral mechanism is associated with the how the person perceives or anticipates any clues and erotic clues. So there is definitely an imbalance in the anticipatory processing of the clues. Now, we all know about hormones. It's so much talked in the media. So neurotransmitters which are involved with compulsive behavior or hypersexual behavior are mainly the serotonin, dopamine, and norepinephrine. There's a lot of talk about these monoamines, and the main also the reason why these monoamines are also attracting attention is because an overuse of selective serotonin, this is SSRI, which induces sexual dysfunction, and also they are known to decrease libido. So that's why researchers are also drawn to the hormonal etiology or the hormonal pathophysiology of hypersexual disorder. Individuals who suffer from Parkinson disease or Parkinson syndrome are shown to have disinhibited sexual behavior or hypersexual behavior, mainly because of the treatment, the medication given to the individual. They increase the dopamine level and that's why the disinhibited or the hypersexual behaviors are seen. Now, we all know about testosterone involved in sexual desire and increase libido, and that's why researchers are also drawn to testosterone level. Is the person who is an individual who shows high sexuality or high sexual behavior or hypersexual disorder, would that pathophysiology direct to increase in testosterone level? Well, the researchers are still trying to dig the reason for this. Now, very commonly, I get clients who somehow are confused with the terminology of hypersexuality, or it is high sex drive, or it is high sexual appetite. So one has to understand that a sexual desire or a sexual behavior cannot necessarily be a pathology. It can be a coupled discrepancy. It can be just a difference in a desire level or an appetite level. And very commonly clients come to me by saying that my husband wants sex all the time, or my wife is wanting sex all the time. And I try to bring an awareness to understanding what a desire is. Like anybody, some people like Chinese, some people like Indian food, some people like pink color, some people, it is a preferences, it is so is a sexual desire. Some people want to have sex every day, well, that could be normal for them. Some people would like to have sex once in a week or once in a month. It actually depends on an individual. So we cannot really say that just because somebody like enjoys having sex or would want to indulge in sexual behavior, that is a diagnostic criteria that one is a sex addict or one is a hypersexual person. Maybe the person just has high sex appetite. So researchers have seen that hypersexual group, like how do you distinguish between this is a pathology, that this is a problem, or this is a normal for normal for an individual. So the hypersexual group have significantly seen to be significantly higher odds of being single. They might be in a relationship, they might be in a married, and not exclusively this hypersexual behavior is directed to heterosexuality. Individual in this group are seen to be religious, also suffer from depression, anxiety, and are tend to get very sexually bored. Hypersexual group are seen to have substance abuse tendencies, and they hold negative attitudes towards pornography use and a tendency to evaluate their own sexuality very negatively. But this is not seen in individual with high sexual desire. Now, also in contrast, the men with high sexual desire differ from the other group only in that they have more positivity towards pornography use. And I must tell you, as a sexologist, like me and Dr. Martha are the trained, pornography use is not completely bad or prohibited. And a more somebody who can really throw light on on pornography use in a couple would be a sexologist like me and Dr. Martha. So it is very important that whenever you have any concerns, you see professionals who are trained in this field. Also, hypersexual men do not use pornography more often because, as we said, they have more negative views about use of pornography. And they and how do you also differentiate between individual with high sexual desire is they perceive that their sex desire is out of control and they want to control it, they want to avoid it, or they want to hide it from individual. It is shown that in the hypersexual group or individuals who have hypersexual disorder, their decision making is impaired. There is risk insensitivity. So that's why this individual is not able to make a proper decision in situations where it will be ethically right to be involved in sexual behavior, or absolutely there is no sensitivity towards high sex behavior. So for example, I had a client a few years ago he, where this was a real problem for him. And he would be involved, he was caught once in his office having sex with one of his colleagues, and that could be serious. And that is where we talk in terms of people having high sex desire to becoming a real problem. And individual who cannot have control, like it's seen that hypersexual group individual do not have control on their impulses. If they are impulse, if they have a desire, they actually act on their impulse. And this is also again aligned with the sexual addiction behavior or an addictive behavior. Now, hypersexual disorders can be paraphilic or non-paraphilic. Now, paraphilic behavior refers to behaviors that are considered to be outside the conventional range of sexual behavior. And quickly, I will tell you that according to the DSM-5, exhibitionism, voyeurism, pedophilia, all these are behaviors of paraphilic condition. And there are conditions which are not paraphilic, that individual who are having disorder like the hypersexual disorder, but they attend strip clubs. They are involved in compulsive masturbation. They are involved in paying for prostitution. excessive use of pornography use all throughout the day. There is no time sense. There is no understanding of other responsibilities. Excessive use of pornography and repeatedly engaging in extramarital affair for sexual satisfaction. So when we talk about sorry, I'm sorry. When we talk about what can be an hypersexual disorder, and why is it so different from individual with high sexual drive or high sexual appetite, and it is good to be. I want to bring your attention to when there is an increased frequency and intensity of fantasies, arousal, urges, and behavior. When there is an increase, there is loss of control and progressive high risk taking behavior. Like any addiction, like one can go to any extent, take any high risk behavior to fulfill their fantasies or fulfill their urges. And there is also a tolerance level. That means the person is involved in more high risk behavior, want to do more high risk sexual behaviors, because there is a tolerance level which has reached, and which is again consistent with the behavioral addiction like gambling, marijuana, drug abuse, or substance abuse. There is, and again, more time spent, an excessive time spent engaged in sexual activity, the use of sex as a way to regulate negative affective behavior. I'm feeling depressed, what I can do, have sex. I'm feeling very anxious, I want to have sex. So there is a dysregulation in the effective behavior, in the regulating the mood. There is violation, impairment, continued engagement in behavior despite of adverse consequences. So again, I want to bring to your notice that a pathological disorder like pathological hypersexual disorder or high sexual drive are two different entities, and should be really diagnosed, or should be really dealt with a lot of knowledge and information, because it is very easy to call somebody a sex addict. And I'm going to talk more what happens to individuals when they are stigmatized like this. So the first is high sexual drive, which incorporates sexual preoccupation and sexual risk-taking behavior. And there are these components, and the main component here is dysregulation of sexuality. That is sex is used as a coping behavior, as difficulty in not being able to control the sexual behavior. This is also commonly seen with antisocial personalities and people who have psychopathological condition where they are very impulsive and the emotional control is damaged. Now, talking in terms of emotional dysregulation, now dysregulated sexuality as an important component separates. Now, this again, I want to emphasize how emotional dysregulation separates a high sexual desire person from a pathological psychosexual disorder. So here I would like to explain to a cyclic pattern. So a cyclic pattern whereby individual first experiences negative affect. Person feels depressed, lonely, or anxious. And then there is an perceived as unbearable urge to be involved in a sexual behavior. So that is perceived as an unbearable, and such individuals engage in sexual behavior in order to temporarily relieve this stress which they're experiencing. They want to release the emotional imbalance which they're experiencing. Now, uh, now, in general, also when in couples involved in relationships, married couple, sex can be used as a way to alleviate some emotions. But how would that differentiate in somebody who really has a pathology where this individual uses only sex as the most inflexible, rigid manner, and sex as the only mode of releasing their sexual stress, or releasing or modulating their emotions? Whereas in people who have high sex desire, yeah, the sex is not the way only they would be. The sex is not the only rigid form of releasing or modulating their emotions. And in individuals who are who have sexual disorder would be conceptualized as having sex as a response focused emotional regulation strategy. So sex is the only way they feel, I want to regulate my emotions, I want to feel good. This is, and there is no other way which is going to make me feel good. Another way how you could differentiate somebody who has an high sex desire to a disorder is there is lack of intimacy. So individuals who have a pathology or who have a disorder and who are not able to control their sexual urges, there is a lack of intimacy. So the reason why somebody who has a pathology or who has a disorder will be involved in sex is not just because they are intimate with they want to be intimate, or it is because they want to love this person. It is there is a lack of intimacy in this condition. And that's how also we will differentiate a disorder among somebody who was just high sex drive. This is a model where there is commonly described in sexual desire or sexual interest is the dual control model. And this is a balance of the excitation of the brain, or the excitation of the stimulus, and the inhibitory stimulus. So too much of excitation, too much of exposure to pornography, too much of exposure to explicit viewing, that can lead to excitatory and can excitatory behavior, and can cause an imbalance in the excitation and inhibition. So an individual who will have a better control and better control of their behaviors will not exhibit an out of control sexuality. um, an individual who also is experiencing a very strong urge to be involved in sexual behavior, this out of control behavior, out of control thoughts, will be also having a lot of self blaming. They have shame and guilt, and this shame and guilt can also be due to the social norms, because there is a pathology which is created around individual with high sex desire. So when pathologizing too much of sex may produce negative feeling in an individual, that they be having self-blaming behavior, shame and guilt. And and that's how people do not come out to seek a professional help, because of all this negative feeling around in the society about sexuality. So, uh, a typical case of hypersexual disorder would be expected to display specifically these three phenomena: unsuccessful attempts to control one's sexuality, use sex as a primary coping mechanism, and experiencing negative consequences of their sexual behavior because of unable to control and because of their coping mechanism. And this person experiences a lot of negative consequences and still not able to control their behavior. Now, there is also confusion about the diagnosis, or there is a lot of confusion about what is an hypersexual behavior, because it is so interlinked with various other phenomena or various other pathophysiologies, which are very similar to addictive disorder. There is this person is continue, for example, continued engagement in the behavioral despite of physical and psychological consequence. There is a loss of control and a preoccupation with being involved with this behavior. This is very similar to an addictive disorder. Now, sudden urge, and I want to fulfill this urge with only having sex, is more aligned with impulse control disorder, where the sexual obsession and compulsion is to act out sexually in the way that resembles the OCD disorder. So when you see an hypersexual disorder behavior, one cannot really say, oh, this is the cause, and this could be the only track to a hypersexual behavior, because this can be an addictive behavior. The person is involved because of the reward system, because of constant pleasant behavior. Also, this can also be an impulse control. The person is not able to control and indulges in sexual behaviors. And so, as I was talking about, the person is involved in sexual behavior or in in this condition, despite of the consequences this person is facing, which aligns with the impulse control behavior and also aligns with the addictive disorders. So in terms of what are the consequences a person faces because of this particular hypersexual behavior, there could be medical consequences. That this person, individual with hypersexual disorders, are very prone to sexually transmitted diseases, HIV, hepatitis, syphilis, gonorrhea. Also, the other consequence somebody would an individual would be facing is there is a loss of time, and that is affecting their productivity. A person would be so involved in pornography, or looking for sexual gratification, looking for ways to to be involved in sexual behavior, that there is loss of time. They lost their job. There are financial consequences. There's somebody is completely bankrupt. Like, I had an individual who would go and spend around thousands of dollars per week and per month. Also would borrow money to go to a strip club to see a prostitute, and that can be such a traumatizing experience for this individual and for the family. Now, individual also face a lot of legal consequences, like they are arrested for their behavior. They're arrest and legal consequences can happen when engaged in paraphilic act, which of course are illegal. And there is innumerous psychological consequence: depression, anxiety, getting prone to substance abuse. Then, now, how does this affect? If this is affecting medically, this is affecting the person's job, this is affecting the person's proper use of time. It is also seen that this is affecting the person's relationship. The family is being affected, because if such an individual is involved in a relationship, there is an unhealthy and unrealistic expectation in a regular sexual relationship. There could be a pressure created on the partner to be involved in various sexual acts, which would not be which the partner will not agree to, and which would not be ethically right also. So these are consequences, because they start creating an unrealistic expectation. Also, if this desire is not fulfilled with an individual, this person would go to have extramarital affair, or affair with multiple individual, would start to seek sexual outlet, attend more of strip clubs, more of prostitution, and this will be involved with a lot of shame and guilt also. So there is a lot of stigmatization in the media and criminalization of sexual offenders, and creates an atmosphere that does not promote treatment and prevention. So there is, as I said, there's a lot of shame and guilt involved. So even if an individual experiences this uncontrolled behavior, this consequences, there is so much of shame and guilt and criminalization in the society, that these individuals do not seek treatment. And 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 these behavior can be prevented with the help of professional like Dr. Martha's there, or me, and there are so many who specialize in the field of sexuality, and can certainly help in these these can help these individuals. Now, of course, since not a lot is talked, there's no proper criteria, there are no proper definitions. Professionals sometimes do not even know how to diagnose these conditions. And thankfully, we have measurements, we have scales which can help and professional to see if this person is actually having an pathological condition or a disorder, or distinguish this individual with high sex drive. And uh, I'll, I'll, I'll quickly brush through these scales because of time constraint, but this recording will be available, and you can read these scales at your leisure. So the first scale, which is involved, and which can be used and more directed towards addictive behavior, is the compulsive sexual behavior inventory. Um, all these scales are questionnaires which can be given to individual, like printouts can be it can be self-filled questionnaires, or a professional can give this questionnaire to the individual if the person doesn't know how to read or doesn't want to fill this questionnaire by itself. So it can be administered or it can be self-filled. So quickly, the various scales are compulsive sexual behavior inventory, sexual behavior inventory, hypersexual behavior. There is a sexual addiction screening test, which is also available in the revised version for women and individual who have sex with the same gender. Newer sexual addiction screening test, this is what it is, and the sexual compulsivity scale, hypersexual disorders screening inventory. So these are various scales available for professionals if they are not trained in the field and do not know how to really diagnose or how to help this individual, or how to differentiate between hypersexual disorder and high sex drive. I'll quickly brush through this. So this is compulsive sexual behavior inventory, and this is a 22-item self-report measurement with, again, the two major scales, which is measuring the control, because as we talked about, there's a lack of control in the behavior, and there is violence. The hypersexual behavioral inventory is a 19-item scale, which involves questions around coping mechanism, control, and what consequences an individual faces. The sexual addiction screening test, which is more is developed to identify individual if they have a compulsive behavior more aligned to the addiction or the OCD behavior, and this was also modified for women and for internet sexual behavior users, people who show pornography, excess of pornography use. So this is a very a nice scale to be used, a nice screening test to be used. And along with this can be used a behavioral screening test, which is in which a total of 7 sexual orgasm per week. I don't know how much is this really helpful, but this scale is used, and this is more in terms of quantifying a sexual behavior than the quality. So it's like how many times an individual is having orgasm. Oh, that can be a real problem, and that can be diagnosed as hypersexual disorder. Now we have the sexual addiction screening test, as I told you. This is also aligned with the addiction side of a hypersexual disorder, and this involves the 4-component: preoccupation, lack of control, relationship disturbances, and affective disturbances. Hypersexual disorder screening inventory. This helps in screening: is this person just hypersexual, or is it a disorder, or is it just an high sex desire? Compulsivity scale, more aligned with the OCD, that is obsessive compulsive behavior. And this defines a sexual compulsivity as a focus and intense need to meet one's sexual needs. Once we talk about what causes hypersexual behavior, is it or it is a disorder or just an high sex drive, I will also talk about what are the interventions available. As I told you, there is so much of stigma, there is so much of criminalization to the condition that one has to be very mindful of when we talk to an individual with these behaviors. So as a professional, one needs to understand that normalization of sexual expression, one needs to, a professional who is trained in sexuality or sexual medicine or is a sexologist or sex coach, does know how to have this, to become a vessel for an individual to come and talk about their sexuality without a bias. And that is what a professional who is trained in this field knows, that normalization of sexual expression in individuals are prone to self stigma should also be a part of the clinical intervention. This is also for women, particularly important for women and men who are more driven by shame and guilt because of their sexuality. Now, the intervention should be focused on basically the control aspect, the controlling of the sexual urges or the sexual behavior, and efficacy to handle with overwhelming sexual urges. The various techniques which are now very commonly used are the mindful based techniques. uh, Being present, being aware of your thoughts, being aware of your urges. So mindful based treatment and its variant are more focused on the mindfulness based stress reduction. Mindful strategies are used to increase self-regulation by breaking the conditioned effect that, okay, if I feel nervous, if I feel anxious, I feel depressed, this is the only way out. So breaking the conditioned cycle, breaking the behavioral pattern, and decreasing emotional reactivity. As we talked about the emotional dysregulation involved in hypersexual disorder. So decreasing the emotional reactivity and increasing tolerance, increasing the distress tolerance and the self acceptance, because we talked about the shame and guilt involved with somebody experiencing this behavior. Now, mindfulness based treatment is also involved with improving the stress coping mechanism of this individual. So, as I said, it is a lot of distress for somebody to control these urges, because it is not just a very quick phenomena that, oh, I have this urge, let me just control. When a person is involved with a behavioral disorder or obsessive compulsive disorder, it is a lot of stress to this individual to control this thought, control this behavior. And mindful technique can help in improving the stress coping mechanism, then in the effective regulation, and to increase tolerance to the maladaptive sexual urges and impulses. And it also helps in ameliorating the sexual preoccupation, the constant thought. So once these techniques are taught to these individuals, they can actually decrease the preoccupation and also have a better control of their sexual urges. Now, there are various forms of psychotherapies available. And again, I would re-emphasize that don't make Google or don't make media your professional, your healthcare professional, your sexual professional. Please go to a individual who is trained in this field, a sexologist, a sexual medicine practitioner, or a psychiatrist who would know how to deal with the complexity of this behavior. So the various psychotherapies available are the individual psychotherapies, which mainly are two common types: the cognitive behavioral therapy and the psychodynamic therapy. Now, what is cognitive behavioral therapy? The three word defines it very clearly. You help a person change the cognition, which helps in change the behavior, and that is the therapy. So cognitive behavior therapy identifies the triggers to this sexual behavior and helps in reshaping cognitive distortions about sexual behaviors, and emphasizes also on relapse prevention, because it's not just the therapy and one time of therapy or a couple sessions of cognitive behavioral therapy which is going to help this person. Now, when an individual is involved in that cyclic pattern of obsessive compulsive behavior or an addictive behavior of sexuality, you should also focus on relapse prevention. So this is a very important aspect of intervention or therapy. Psychodynamic therapy. Now this explores the core conflict that drives dysfunctional sexual expression, and mainly focusing on the theme of shame, the avoidance, the anger, and the impaired self-esteem and efficacy are common to be dealt in a psychodynamic psychotherapy. And as we talked about, that this behavior can cause a lot of discomfort, can cause a lot of consequences in the relationship, in the couple's relationship, and in the family. We should not forget about the importance of family therapy and the couples therapy. This is mainly to restore trust, minimize the shame and guilt in that relationship, and establish a very healthy sexual relationship between the partner and a healthy relationship in the family. Of course, there are a lot of pharmacotherapies available, and a lot of being talked about the pharmacotherapy because of the hormones involved, because of the monoenzymes involved. We talked about that in the pathophysiology or the the neurobiology involved. So the rationale for using medication is based on the various work done in the substance abuse population and the pathological gambler population and the OCD population, or more aligned with the OCD type of symptoms seen in sexual behavior. And the pharmacotherapy is seen to reduce the craving and to reduce the craving and the urges by blocking the euphoria. And individuals who are in treatment of any form of substance abuse or substance addiction would know how certain treatment can reduce the craving and urges by blocking the nice feeling, the pleasant feeling, the rewarding feeling to be involved in that behavior. The various medications available are the antidepressant, the mood stabilizers, the antipsychotic treatment, and the anti-androgen treatment. Naltrexone, which is used in individual with who want to leave smoking or who are involved in substance addiction. Naltrexone is very commonly used, but this is also seen to help in reduction of the sexual impulses and the arousal. So these treatments, again, if somebody is has tried the other modalities of psychotherapy about mindfulness and it doesn't work, then these pharmacotherapies are available, but it should be definitely prescribed by a professional who knows about these treatments. SSRIs have been tried because of how SSRIs reduce the libido, and it is also seen to reduce the sexual urges and other aspect of arousal and desire. So this SSRIs have been shown effect in reducing the urges and craving and the preoccupation, which is aligned with the obsessive compulsive behavior. Um, Now, people who really would show good results are individuals who have comorbid condition like depression, anxiety, or who are also diagnosed with obsessive compulsive disorder. SSRI can be very useful in these individuals. Mood stabilizer, because it's more aligned with the dysregulation of the mood. So mood stabilizers are available and can be prescribed to control these urges and the dysregulation of emotion. Valproic acid, lithium, other treatment modalities are topiramate and nifazodone. And since we talked about the androgens, which can also play an important role in sexual urges and desire, there are anti-androgen treatments available, and which should be prescribed by professionals. Lastly, if the behavior is so out of control, there are surgical intervention, which I don't think so I've heard in recent past, but there are treatments available for individuals who have like they have completed all the treatments, nothing seems to work, then surgical treatments are available in and that is the most severe form which can go. But there are inpatient and intensive outpatient treatment available at various hospitals or medical healthcare facilities for individuals who really want to seek treatment. And this behavior, the sexual behavior, is a real big problem for these individuals. So they can also have inpatient and also outpatient, but an intensive treatment program where involvement of a medical health professional, um, social worker, involvement of the psychologist or psychotherapist, all work as a team for an intensive treatment to help this individual. Now, what other modalities are available to help these individuals who are really suffering or who really have this out of control behavior? They cannot go to a professional because of the shame and guilt, and also because, oh my God, they will be diagnosed as a sex offender, or they could potentially be a sex offender criminalization problems. There are various sex addict anonymous group, similar like the alcohol anonymous group, which are based on the 12-step theory. Many of them are available in the United States, but they all make a safe place for an individual to come and talk about what this individual feels, what this individual is facing in life, like the consequences, and can find support group. So there are sexual addiction anonymous group, Sex and Love Addiction Anonymous Group, and the Sexologist, oh, Sex Holog. Oh, I'm so sorry for the pronunciation. I don't know why it's not coming to me. But there are various groups where individuals can really go and find support and find a safe place to express themselves. Uh, so, with this, I hope I have cleared a few myths about what can be a differentiation between an hypersexual disorder or somebody who just has a high sex drive or a high sex appetite, because it's very easy to just get carried away with the various terminology, but it's very important to understand that these terminologies are very different. When you talk about disorder, it is more aligned in terms of obsessive compulsive behavior or an addictive behavior or an impulse control behavior. And when you talk about high sex drive, this is an individual who has a high sex appetite, who has never faced any legal problems, who is not who is not lost in watching pornography all the time, who's not had has financial or legal problems. So there is a clear distinction between a disorder. There is a clear distinction between a desire, and one has to be very mindful when using these terminologies, because this again causes a lot of shame, a lot of guilt. And even if there is a problem this person is facing, this person wouldn't want to go for a treatment or an intervention because of a lot of stigma involved, lot of criminalization involved. And as always, I suggest that please don't make Google or do not make internet your teacher, or do not make the internet your doctor. It is advisable to see a professional who is trained in this field, to seek advice from an individual who knows about this subject and would be able to guide you. But don't be driven, don't be shame driven, don't be guilt driven, but seek for help. There is a lot of help available around. There is a lot of uh, professionals who are there to help you. So please reach out. Dr. Martha is there. Please reach out if you would need some names and references, to references whom you would like to approach for help or even for education, because knowing what is right, what is social norm which is accepted in the society is also very important. And is this a normal sexual behavior? Because media tends to really magnify everything. It is there's so much of I should say nowadays there is so much immunization to a lot of neurosensory input available from media, that everything just becomes, oh, this is there, this is so easily accessible, and it is okay to watch, it is okay to be carried away. But a professional who is really trained in this field would be able to guide you in and help you. So please reach out um, to any professional, and they could be able to guide you in the right direction if you need help or you just need knowledge. Lastly, I thank Dr. Martha. I thank the organizers of Sugar and Spice for such a wonderful event and enlightening the society on these topics, which is not spoken very openly. And I hope Dr. Martha, the organizers, and Sugar and Spice continue to grow and expand and spread sexual positivity and sexual wellness throughout the world. So thank you, Dr. Martha. Thank you, organizers of Sugar and Spice. And thank you to all my teachers and my gurus for giving me this opportunity and giving me the education so I can share it with you all. Thank you. I'll open myself for question and answers, or if you need some clarification, please feel free for questions. And these
Hi,
are my
Anita.
references.
We have questions. We have two.
Yes.
What is the population breakdown of this study? Example, country, age, ethnicity, based on the slides you provided a while ago.
Wonderful. That is a very nice question. And there is no specific data, as I mentioned in one of my slides, but it is according to the few research and the publications are at the end. There are around 4 to 5% of a general population which can have this problem or which can have hypersexual disorder. And it is more, and the ratio or the prevalence and incidence increases with individuals with schizophrenia, with mood disorder, substance abuse disorder, or even in an individual which have pathological conditions like frontal lobe lesions, Huntington chorea, Parkinson disease, or on medication which can alter the hormonal or the brain chemistry. Now, ethnicity, there is not much talked about this. There is no much data and research available, but some researchers have seen high incidence or high behavior in men more than women. And now that could be because there is lack of research done. There is lack of proper guidelines which helps in diagnosing or classifying these individuals. So there is just so much lack of research done in this field that there is no uh, direct answer to which ethnicity shows more prevalence in hypersexual behavior or high sexuality. There is no research which says that.
Another question says, I suppose the sex here refers to intercourse.
Sex here refers definitely to intercourse, but also to other forms of sexual outlets that, as we just talked about, pornography use, masturbation, and using other form of method for sexual release. So it involves sex in here involves, of course, sex intercourse and other form of sexual outlets.
Okay, for the last question, have there been any trends identified following last year?
Trends. There is, oh yeah, of course, a lot of, because of COVID, individuals are inside the house, they are stuck. All access is internet, all access to pornography. There has been a tremendous increase in pornography use, right from individuals who are adolescent to adults. So there has an increase in hypersexual disorder have definitely um, um, the incidents have increased mainly because people have not been able to go out. So all they have is the internet available, and internet takes you to the around the world, showing different colors, sizes, and the curiosity keeps on building. There is definitely a pleasant behavior, a pleasant feeling, the cyclic pattern of the reward system, the compulsive behavior. So there has been definitely increase, because I have come across so many clients who have reached out to me for their impulse control, for the obsessive and compulsive behavior related to sexuality. And trust me that media doesn't help in these cases. There is just so much free resources available that the young generation, um, the individuals who are away from their partners, or who have more easy accessibility, are getting driven into this path of impulsive behavior, or the cyclic pattern of obsessive compulsive thoughts or addictive behavior. So there has definitely been an increase in this area. And I have seen so many. I work as at a non-profit organization helping individuals, and we have come across so many adolescent age group, and this type of behavior is seen in as early as 14, 15 years of age as well. So thank you so much for this thank you so much for this question. So as an I should say, as an individual, as a citizen, as a good human being, one needs to be aware, and one needs to also be vigilant, keep an eye open. If you have an adolescent in your family, or if you know somebody, you have to be aware of these conditions, how the media is driving or affecting the younger generation, and also affecting individuals. So thank you so much for this question.
There are no more questions from the people here.
Wonderful. So thank you so much, Martha, and thank you so much, the Sugar and Spice organizer, for this wonderful opportunity. And I wish you good luck for everything.
Thank you so much for doing this. It was very comprehensive and useful.
Thank you, Martha. Have a wonderful day ahead and a wonderful season of Sugar and Spice.
Thank you.
Bye bye.